Hi, everybody. It's Dr. Dave Morris with Magnolia Medical Center and my lovely assistant slash wife.
Wife, definitely wife.
Wife, definitely wife.
Yeah.
The person in charge. So we want to talk to you about fibromyalgia. All right, we're going to talk to you about fibromyalgia today. The myth of fibromyalgia. Now, before you go off the deep end and tell me that fibromyalgia is real, I'm going to agree with you. Fibromyalgia is real. It's classified as a rheumatic autoimmune disease. People absolutely suffer, but what I want to talk to you about is really kind of the myth that you're told that there's nothing that you can do about it, right? And who told you there wasn't a cure, right? So that people tell you that there's not a cure for fibromyalgia. I'm here to tell you that is 100% not true. And I know that because we've been treating people for the better part of 22 years and helping people with these problems and actually solving the issues. So here's what you're not going to do, okay? You are not going to find the magic supplement on late night television or in a magazine that is going to cure your fibromyalgia, right? It's not going to happen. You're not going to find that magic supplement, okay? And you may hear great testimonials about some magic supplement from the people who rolled the dice, all right? And everybody who rolls the dice sooner or later is going to come up with the lucky seven, right? So, you know what I mean? Like it's going to, if you keep rolling the dice, sooner or later, somebody's going to win. And it's those people that give testimonials about some magic supplement from the African rainforest or some other place, and it magically heals their problem. So that for most of you is not going to occur. So stop buying the magic supplement, trying to find that solution by rolling the dice. It's costing you money. How many people have this cabinets full of supplements?
I think here's the problem, and this kind of speaks to what we want to cover for our listeners and for the patients that come to our office. There's a reason you have the symptom set that you have. So the pain that you feel, the discomfort that you feel, the way that your joints feel, and the way that your muscles feel is very real, and there is no arguing with that at all. How you
Correct.
feel is very real. But what's missed with both modern medical treatments, but also what's missed with that magic supplement is the underlying reason why you experience those symptoms. So if Dr. Morris here was diagnosed with fibromyalgia and I was also diagnosed with fibromyalgia, our symptom set would not be identical. They might be similar, but the underlying reasons why he's experienced what he is experiencing and why I'm experiencing what I'm experiencing are not going to be the same. So the African rainforest supplement that he orders might work incredible for the underlying reason that he's experiencing fibromyalgia. And the problem that I think patients run into nowadays is that you go to the doctor, more traditional medicine, you now have a diagnosis of a thing, and then there is the treatment for that thing.
Look, that treatment, I'm just going to tell you, you know how my stance on this already if you've been watching me, that treatment is going to be medication. Okay. Right. And I want you to understand that's not because your doctor's a jerk. It's not because he doesn't want to help you.
Right.
Here's the problem. Okay. The doctor goes to school for nearly 12 years between school, residency, internship, and all that, 12 years. Okay. And basic human physiology, I did this school, right? Basic human physiology is done and covered like the first part of it, right? Hi there, Lauren. That was our office manager, Lauren. She's awesome. So the basic human physiology is covered in the beginning, and then everything else is covered towards the end. Then you graduate school and you're out and you hang up your shingle. And now the latest research, the day you start practice, you are 10 years behind the latest research. Now, you're hanging up your shingle. You've got to make ends meet. You got to pay back student loans. You got to pay your bill. You got your rent. You got to pay all these things. And you don't have time to stay up on current research. So who do you listen to? You listen to the people that come to you and tell you, we've got this great medication that's going to handle the problem of your patients that are suffering with pain. And he gets to get all this information about how to handle his patient's problem in a 30-minute lunch with some skirt, no offense, but some skirt who's sitting there saying, this is the latest and greatest medication about how to handle a problem. And you're looking for a solution. You're looking for pain relief. He's trying to help you. Right. And the information he's getting that quote unquote is the latest research, which is a bunch of bull, is from drug red.
Right.
All right. And so you're not going to get the solutions that way. So from the standpoint of fibromyalgia, all right, symptoms, right? Widespread musculoskeletal pain, number one.
Sure, and let's talk about this first. So this is how this is diagnosed. It's diagnosed by a survey of symptoms, so an assessment of symptoms. That's how we get to this diagnosis. So,
yeah, a real diagnosis,
right.
But it is still an assessment of symptoms. It's not an assessment of cause. It's an assessment of symptoms.
Correct. Okay, good.
So aching, fatigue, localized tenderness, tender lymph nodes, morning stiffness, heart palpitations, dizziness, aching, TMJ issues, depression, anxiety, IBS, Raynaud syndrome. So these are the most common symptoms or diagnosis that someone may have. Okay. So appreciate the comments, by the way. They're just coming in pretty quickly. I can't keep up with them. So, but none of those are going to be a cause, and your doctor does not have the time to look at causes. Right. So how do you look for causes? Okay. I'm going to just give you the basics. Okay. First of all, somebody has to really truly understand how to read lab work. Okay.
Yes. Key point.
And I've got other videos on how to read lab work properly. Your doctors, they scan through the labs and look for the highs and anything that's outside of the highs and the lows. And most of the time, anything else, even though it's within range, is ignored. And they say, you're fine. Nothing's wrong with you. Give me some likes. If you've ever heard, they looked at your labs and they said, nothing's wrong with you. You still feel like SHI.
Whoa. Okay, good. So this is nearly every person that we see who has been to their doctor, their labs are normal, and they're told you're fine, or they're told, maybe you're just having some depression. Maybe they think it's in your head. You're made to feel a little bit crazy about the pain that you're experiencing. I see a lot of likes. So this has happened to so many of you, and we know that to be true. And we know that that's a lot of BS coming from your doctor, unfortunately. Not that that person is a bad guy, but all of these likes that are coming through right now, we know, we hear you. We hear it from patients all the time. Thank you.
All right. So when you look at lab work, you have to look at it correctly. All right. That's the first problem with your doctor's schedule. He just does not have time to sit down and look at your lab work with a fine tooth comb and pick it apart and actually compare it to truly healthy. He's comparing you to a bunch of sick people. All right. Now, the first thing you want to look at is a full, proper, comprehensive metabolic panel and a complete blood count. All right, those are basic labs, and if you're looked at properly, so many underlying causes can be found just based on that. Those two labs together, even if you're paying cash for a lab, might cost you $40. Okay, right. You have to have somebody to look at it properly. The next thing. Okay, and some of you are going to hate me for this, but it's the truth. You have to pay attention to your digestive system. Okay,
right.
You have to get this checked. Two things you want to have checked. Okay, is you want to have checked your intestinal permeability. So that means, are things that you're putting into your mouth that are getting into your body, going into your digestive system, are they getting into your bloodstream before they're broken down fully, or are they getting them all when they shouldn't? Intestinal permeability, most of you have heard about leaky gut.
Right.
You need to not just guess about that. You need a firm diagnosis. You need a lab test that can tell you, is that happening or isn't? Okay.
Yeah.
Your doctors aren't going to look for it. No offense to your doctors again, because they're going to be like, I don't even know how to read that test. Right. So also looking at your gut is going to be a stool analysis. Sounds gross. It is gross. You're looking at your
poop. It's not a carnival of fun.
Yeah, it's not a carnival of fun. But you got to look at the bugs and the critters and all those things that live in your gut. Your immune system, 70 to 80% of your immune system exists in your intestines, right? So we're talking about an autoimmune condition per diagnosis, a rheumatic autoimmune condition.
Right.
70 to 80% of your immune system exists in your gut. And when you see your doctor and he doesn't ask you about your diet, doesn't ask you about digestion, doesn't ask you about your bowel habits, doesn't ask you about any of those things, you have to understand an autoimmune condition and you're missing 70 to 80% of the equation.
Right.
So you've got to look at that. You've got to look to see you have parasites. How many of you had that checked? Now, should they run right out and buy the greatest, the South African parasite cleanse?
No.
Do not do that. Okay. Don't go down your health food store and go, oh, Dr. Morris said I might have parasites. Let me get on the parasite cleanse. First of all, there's so many different types of parasites. And none of those things are generally good for all of them. And some of them are only good for a few, and you might be missing a lot of it. And you could make yourself worse.
Right.
So don't go down and search your local health food store for the latest parasite cleanse. I don't care how good the person is, how friends you are with them. I don't care how many thousands of dollars you've given them over the year. They might send you Christmas cards, for crying out loud, because you spent so much there. But you need to have that checked. Now, the other thing is you're going to need to have a proper thyroid panel checked. Okay. And again, you can get the thyroid panel done. You can have all the right labs checked on your thyroid. You can have your doctor run them all. And if they don't look at them properly, again, you're going to miss the equation. So these are things that you have to look for. These are the basics. Sometimes we get lucky and you find the solution just with a CBC, a complete blood count, and a chem panel. Most of the time, you're going to get some specialized labs that if you find the underlying reasons why you have the problem, guess what? The immune system starts to regulate itself. Your pain goes away, the anxiety and depression goes away, your digestion gets fixed. It can be incredible. Now, I haven't read any of these comments.
I'm going to interrupt you. Okay, first of all, Dorothy, thank you. I was doing a great job. He shouldn't have interrupted me. That's kind of my favorite comment so far.
Hey, Dorothy, I thought we were friends.
No,
Dorothy.
That's all right. And Twila, I love it. I love that you came to your own conclusion on it and didn't follow just what your doctor had fed to you. That is so great. It just takes really patients being their own advocates.
And hormones can be part of the problem too.
Definitely. And yes, fibro is categorized as an autoimmune condition for sure. Alma, you had mentioned that. Someone had a question about the name of the test. Recap the tests so that we've got these covered.
Basic blood panel. Okay, basic blood panel for us would be a complete metabolic panel, a complete blood count with a differential. Okay, that and I won't go into all these things right now. Your doctor knows what those are. You're going to want to get a comprehensive diagnostic stool analysis. That's usually called a CDSI, comprehensive diagnostic stool analysis. Yep. And you're going to want to look at, as part of that blood work, you want to look at a full thyroid panel. That's about 9 different labs for a full thyroid panel. And you may need to look at hormones. Okay, you may need to look at hormones, food sensitivities. There may be other things to look at, but those are the basics, right? A complete blood count, a complete metabolic panel, a comprehensive diagnostic stool analysis, the intestinal permeability test, and as part of that blood work, the full thyroid. Those would be the minimum that you need to look for to determine what is the underlying cause. I can't tell you, it's just two people are not the same.
Right.
Stop looking for your solution. And I'm not trying to be disrespectful to you. I'm imploring you for you to be healthy. Stop trying to look for your solution based on somebody else's solution and problem. Okay. It hasn't helped you so far. You wouldn't be watching, right? So you got to look at a grossly unique,
right.
So a solution, a causal solution to your problem. All right. It can be solved. I promise. We see it every day that people are getting better when they were already told that there's nothing that can be done. There's no cure. There's nothing you're going to do. You're going to suffer. You're going to be on the medication, the gabapentin, the Neurontin, the Lyrica. You know how I feel about those. And I talk about this the most, but the truth of the matter is my passion would be getting people off all the opioids, right? So all those opioids and things that are being taken out there, and 70,000 people died last year from that. So,
all right, we're going to bring it to a close. Here's your takeaways from this. Number 1, it's not in your head. We hear you. We hear you loud and clear. We know you feel how you feel. What you have going on is not in your mind. It is in your body. And there is an underlying reason for it. Takeaway number 2 is your unique cause is different than the next person's cause, even though you might end up with the same diagnosis. So getting to the bottom of it is the way to resolve it for you. Takeaway number 3, you can heal. Your body can get better. If you've been told that there's nothing that can be done for what you have going on, you disregard that and know for yourself that your body can get better. Just got to get to the underlying reasons for it. Takeaway number 4 is all those lab tests Dr. Morse mentioned. Yeah.
Now, with all those lab tests and somebody doing the proper analysis of those lab tests, a lot of you are going to go, what's that going to cost? I don't know. It depends on where you go.
Right.
Sometimes these lab work can be covered by insurance. A lot of times the specialty labs are not covered by insurance. And it may cost you, let's assume that a full program when paying somebody to analyze all that, not just get the test, but analyze it, would cost you, and let's say it costs you $5,000. That's a lot of money, and not everybody has it lying around. I'm just telling you what you can do. I can tell you this. I used to take calls for a drug rehab where I would refer people. I'd find places for people to go. And one of the things that I found is that when people were desperate, funny enough, they would come up with ways of getting money. They weren't always legal, but they would find ways to get money. And I'm not telling you to do anything illegal. I just want you to be aggressive about solving your problem, and don't try to have your insurance solve it all the time. And again, I'm not being disrespectful. I just have so many times people are like, great, I can't do anything about it. And they're just not being creative in many cases. I'm not assuming any of you are not doing that. I just want to make sure you understand that not everything that we're talking about may or may not be covered by insurance. It might be expensive, but guess what you get to do if you get out of pain? You get to live again. You can go out and maybe make more money. You can do things if you solve your problem. You get to, it's just something we hear a lot, and it's something we want to be transparent about with you, because it is a barrier to people getting better, is the finances on it. And it'd be ridiculous for that not to be part of the equation. If we're going to come and give advice about getting tests done and whatnot, to leave you with the idea that every insurance company, every doctor is going to be on board with this. That's not really true. So do you want to add anything to that?
No, that's it. Y'all, thank you so much for listening. We're going to come to you again soon.
All right. Since fibromyalgia is such a problem, as I always do, I ask you, please share. Some people that are suffering, some of you are belong to support groups and whatever. Some people on your support groups absolutely know some of this stuff. And maybe they've shared it with you already, but I'm telling you, this is what we see as solutions to these problems. We actually see it as solutions in our office with patients.
Yeah.
So you can solve your problem.
For sure.
It may take some help, and it might take some work and some detective work, but you solve your problem. Appreciate you sharing. We'll see you tomorrow.
All right.
Bye.